This specific joint program is the SDG Joint Program on Social Protection, and the goal is to accelerate social protection in Nigeria. We have two specific outcomes. One is to institutionalize social protection in Nigeria through the development of a social protection bill, and then the second is to operationalize social protection in Sokoto State. The ultimate goal is to ensure that social protection systems and programs are well coordinated and implemented among various ministries and agencies. We have 4 implementing agencies, which is UNICEF, ILO, WFP, and UNDP. And then we have WHO, who is not an implementing but a technical support agency to the project. At the federal level, being that the project was signed with the Ministry of Budget and Planning by the Minister, the Ministry of Budget and National Planning is our key partner and implementer in this project.
The joint program actually supported the review of the National Social Protection Policy. And in the course of the review, or support of the review, there was also an emergence of the bill to institutionalize the National Social Protection Policy. And that bill was also supported through the Joint Fund for Social Protection to accelerate the achievement of SDGs in the year 2030.
But we also worked closely with NHIS, the National Health Insurance Scheme, the National Social Safety Net Coordinating Office, the National Cash Transfer Office, both under the umbrella of the Ministry of Humanitarian Affairs. And then in working on the bill, we worked with various ministries such as the Ministry of Justice and the Ministry of Women Affairs and Ministry of Labor. All were very key implementers of social protection in Nigeria.
So it is my hope that this policy will help in addressing these existing poverty gaps in the country, the insurance policies and so on and so forth.
At the state level, we worked with the state counterparts of these agencies that I've mentioned, but in addition, we helped set up the technical working group, which brought together about 12 key MDAs to work as one, collaborating closely on social protection in Sokoto State. When we were designing the project and we were looking at where would have most impact, in doing our research, at that point, I think this was back in 2019, Sokoto State had 87% poverty rate, which was the highest in Nigeria. And when we were looking to see how are we going to implement or where we're going to implement, we identified Sokoto as one of the states which would benefit greatly from the joint program. However, something that was really critical and key to us was also that with the interaction we had had so far with the Sokoto state government and partners, they were very easy to work with, and they were also invested in social protection and how to benefit greatly from either the capacity that can be provided and projects that could be provided into the Sokoto state government. Lastly, a project on girls' child education had been implemented by UNICEF.
A research that was conducted by UNICEF in 2013. When that research was conducted, the parents showed willingness to send their girls' child to school, but because of poverty that they engage the students on some activities at home that support the family. So this was the reason why institutes thought that they should come up with a cash transfer to help the families in order to send their children to school.
Which had been worked on in Sokoto State for a couple of years, and that was the basis for expanding the cash transfer to other sectors beyond education, in this case health sector.
5 years after the establishment of the NHIS, it was realized that only about 5% of Nigerians were covered by the health insurance system. So that necessitated the creation of state health insurance agencies to accelerate universal health coverage. And Sokoto State, fortunately, was among the first states to establish the State Health Insurance Agency that is named Sokoto State Contributory Healthcare Management Agency.
When we decided to work in Sokoto State, we obviously had to work with SOKIMA, but we made sure that our efforts are both at the federal level, working with NHIS, and in Sokoto State with SOKIMA. The joint program has really, I would say about 5 key deliverables. And the key areas are: 1, at the federal level, we aimed to develop a national social protection bill, which at the end of the project, we hope to pass on to the National Assembly. Now, with the National Social Protection Bill, the first step was to make sure that we had a national social protection policy. So those 2 areas were very key for the joint program. The second was also the social protection financing. We supported the government in conducting a study on the review of budget allocation to social protection, and as well we supported the government in identifying physical space for social protection, as well as doing a costing of the national social protection policies.
In the course of the activity plan for the review of the national social protection policy, the joint fund gave us the opportunity to involve all state of the federation, whereby each of the UN agencies that are involved in the joint fund had their own area of focus. For instance, UNDP supported most of the zonal sensitization. Where we went to present the social protection, the under review to state to harvest their inputs.
The third output for us really is accelerating SDGs and through social protection. And in this way, what our key objective was to hold consultations around all 36 states, which we did, to identify quick wins and low-hanging fruits of social protection. Now, going down to Sokoto State, the objective there was to operationalize social protection, and the first was to strengthen the capacity of SOCEMA, which is the State Contributory Healthcare Management Agency, to be able to successfully improve and enhance universal health coverage through the basic healthcare provision funds.
I could remember when we had the last World Universal Health Coverage Day, the support by UN Joint SDG program was applauded because it has increased access to vulnerable people in the society, because the support is for pregnant women, children under 5, adolescent girls, the aged, the disabled. And these are the people that are more vulnerable to risk when they are not covered by health insurance. So, and also the indices of Sokoto State considering maternal and child health is not encouraging, and this project really improved it, going by the data we are collecting from facilities monthly. There is increase in attendance of people that are covered under this project in their ANC and also postnatal, as well as other services that are rendered under the basic minimum package of healthcare services.
The next step was to also help them actualize what the health insurance could be. So we provided health insurance to 6,000 individuals, and the target groups were pregnant women, children under 5, lactating women, adolescent girls, persons with disabilities. We also covered people aged over 65. Health insurance was provided to all these 6,000 people from 3 different communities, and at some point we expanded and to reach 4 communities in the state.
The UN Joint SDG program came to Sokoto and supported like 6,000 beneficiaries from 4 local governments as a pilot. And from that 6,000 people that were supported, we realized now the indices of Sokoto State people that are covered under health insurance moved to 5% from the initial 0.2% that were covered. Then came the Basic Healthcare Provision Fund as well, that provided cover for more than 43,000 people, increasing it to close to 10% of the total population.
The last component of this program was also expanding cash transfer. So the cash transfer worked with 13 different MDAs in the state, creating a cash working group who jointly implemented the cash transfer. The goal of the project was to ensure that we found a way to digitize cash transfer, but also more importantly for us was that the health insurance was available to the individuals or beneficiaries. But how to ensure that uptake they used the health insurance was also an important critical factor. So we found a way to link the cash transfer to the health insurance by providing to the pregnant women transportation reimbursement, so that whenever they visit the clinic, then they will get reimbursed for their transportation. This is also critical because Sokoto State has one of the highest hospital bed rates. Most of the people give birth at home, but with the health insurance and the cash transfer, it made the hospital birth rate increased, giving also children opportunities to have birth certificates and being registered.
The whole purpose of the cash transfer is to have access to the facility, because there are a lot of complaints of beneficiaries that will always tell you that because of the distance or the lack of transportation or access, that's what stopped them from coming to the facility, which gives birth to the low turnout of women accessing medical services, which is the postnatal and the antenatal, the immunization and vaccination at the facility.
Implementing digital cash transfer is actually one of the quickest and fastest way that a government can reach its citizens. So we can easily look at the COVID situation, and given that almost everywhere was on lockdown, and the fact that people, especially vulnerable groups, did not have access or lost their livelihoods, the best way or the best means to reach out to them and provide that social protection for them would have been through digital cash transfer. If they were already registered, targeted, identified, and in the system, then it's easy to disburse funds without actually having to travel and have people come around to distribute cash. So ultimately, digital payment is an effective means of promoting and enhancing quick access to funds for social protection. The cash transfer has benefited the beneficiaries in at least 5 critical areas that we've been looking at. One is that it has helped with monetary poverty. The beneficiaries have told us stories of how, beyond using it for their transportation to the hospital, they're able to save some to be able to start some businesses. We had 2 beneficiaries tell us about how they started a livestock business, and another one talk about how she was able to buy a tailoring machine and is currently taking lessons on how to use it.
Gaskiya rayuwa sai a hankali yanda ba da wanga tallafi, saboda yanzu sanadiyar ɗinkin da nake ina taimaka ma kaina da shi mai gida da dama da abubuwa da dama. Ina taimaka ma kaina kuma ta zuwa asibiti, kuma ba duk sati akai ina kai kaina da yara na asibiti ana bincika lafiyar mu.
Na sai kaji, na sai akuya. Kiwon lafiya yayi unhani kwarai sosai. Yana na taimaka mana sosai da sosai. Muna shan magani kwarai asibitin nan. Da mun je rashin lafiya mun ka da katin nan, insha Allah magani allurai don muna shan su sosai. A'a ba mu ba da komi, muradi dai mu kai katin nan. Da mun ba da katin nan ba an sa komi.
Duk wata yan an ka tura kuɗi ina rage ɗawainin gida da su, irin ina sayan sabulu, wani lokaci ma har a ci abinci da kuɗin, kuma mai ɗawainiyar zuwa asibiti da su.
We had another beneficiary who told us of how he has a high BP, but with the health insurance being provided, he's able to access medical care without paying a dime. He was so surprised and very happy about it. Every month he's able to get medication without paying any services.
Hakika duk zuwan ne kai tun lokacin da an kai min wanga katin, lalle hakika ban koma sayan magani ba. Da duk zo ana ban na wata daya, duk zo a ban magani na wata daya. Yanzu haka ma ban daɗe da zuwa an kaban ba, saboda ina da hawan jini da wasu masassara haka irin mota da duk can nake zuwa an shi magani, ban taɓa sayan magani ba tun kusan da aka fara bani gaskiya.
These cash transfers and the health insurance help with prenatal and maternal health care. It helps with childbirth registration. It helps, for people to be able to, seek services as needed without any concern. We've also been able to link the cash transfer in a way to education. When we're speaking with beneficiaries, they were telling us about how their girls are now able to go to school, and it's helping with the school enrollment, because it's one thing that they don't have to worry about healthcare anymore, and that cash transfer also supports and helps them attain their goals with going to school. One other thing is that it has helped with women's participation in decision making. With cash-based transfer, women can go home, and getting home they have to sometimes turn in the money that they get. Well, digital based, she's the only one that probably knows when the alert comes into her phone or when when she's being paid, and it can help her use the money and utilize the money the way that she deems fit, especially for her family. Lastly, I would say that the cash transfer helps with access to basic services, in the sense that while government may be providing services, access and transportation to be able to get or access to services can always be a challenge. But with having the cash transfer, having some money, it helps for them to be able to use that cash transfer to go and access the services needed.
Some people encounter difficulty to access the service through their, maybe if the area that they are is far from the community, from the health facility, they don't have access to the health facility. Some people are poor. That's their only problem, or ignorance, that they don't know what will bring them to the medical health facility.
To gaskiya abin da ya kawo canji ga rayuwa lokacin da ba a kirkiro wanga abin ba, sai ka fita ka samu kuɗin, sannan ka samu ka wurin likita ka binciki lafiyar ka a baka magani. Yanzu karuwar da an ka samu ba sai ka nemi kuɗin ba, in ka yi kokari ka garzaya asibiti kai tsaye Allah ya sa kuma ka zo ka cimma likita sai ya baka magani kyauta.
Basu ɗauki asibiti na da muhimmanci kamin wanga lokacin din ba, amma da wannan organization ya shigo aka wayar musu da kai, suka samu tallafi, sun ƙara samun goyon bayan a asibiti a duba lafiyar su da check-up ɗinsu. Abu ya canza lokacin da an ka samu, kamin a samu wanga program ɗin ya shigo, kuma da ya samu a takaice mutum 5-6 monthly in the facility waɗanda sun kawo asibiti, amma yanzu muna samu fiye da 10-20 ma ana samu saboda wadda jama'a da an ka samu da kuma support ɗin da sun ka samu na wannan ƙungiyar.
There were a lot of gains to the project, but I'll just mention the biggest gains for us. And I think the first is that identifying that social protection is a right, and a right that should apply to every citizen. And because of that right, we supported the government in developing a social protection bill called the Harmonized Social Protection Bill. Social protection is fragmented, and even at the federal level with different agencies working on different areas of social protection. But this harmonized bill brings together all the ministries, the agencies and departments working in areas of social protection, having a coordinating structure for social protection in Nigeria. Again, when I talk about this gain, we brought together several ministers from the different MDAs implementing social protection together to have a dialogue and a conversation on how to implement the social protection policy and bill and how it can be taken forward. So that was a really good success for us, and I think the next step, and we look forward to seeing that result in future, is to ensure that this bill is passed. Another gain at the federal level would be helping to identify some quick wins and implementable social protection low-hanging fruits, including some identifying different financing mechanisms by using that different states are using. So developing that document that has that information on different social protection efforts being done by different states, I think it's really good, because if any of the states were interested in implementing social protection, they can easily find that as a resource and a go-to document for them. At Sokoto state level, I think goes without saying that the impact that the project has on beneficiaries, even before we go into the government institution, I think is a really big gain for us. Seeing and discussing with the beneficiaries, sharing how the impact of the cash transfer has been on their lives and the lives of their family, I think is a really big gain for us. But most importantly is looking at how the work we did, we worked with a structure. We ensured that we started from the fact that the state did not have a social protection policy. we worked with the state government to develop a technical working group on social protection, with their first task being developing a policy. A policy was developed, was approved by the state executive council. We worked with the state to develop costed the social protection policy. I helped them identify financing mechanisms. We worked with the state to provide 6,000 health insurance to vulnerable groups. We strengthened the organization itself, the institution itself, SOKIMA. We helped them strengthen their capacity to be able to implement, what the agency is meant for, improving health insurance in the state. And one of the best parts of it is that everything we have done in Sokoto State is would be able to remain in place. So if any donor agency or any government institution would like to go into Sokoto State today to implement projects, they would have a structure that is already in place. They will have government partners with expertise to be able to implement projects and would not have to start programming from the beginning.